The basic scoop method is completed without the use of a recapping device. The cap is set down on the tray. Once the injection is complete, the operator simply scoops the cap onto the needle. Once the needle tip is covered, the cap is seated tight. With this method, the operator must closely watch that the needle does not come in contact with the tray surface if the needle may be used again. The following demonstrates the use of cotton pliers to assist in recapping the needle. This method does not require an additional device or disposable items and minimizes the risk of needle contamination from contact with the tray during recapping. The following demonstrates the use of a metal device to hold the cap during needle recapping. Use of this stable, weighted device also minimizes the risk of needle contamination from contact with the tray during recapping. One-handed needle recapping can also be facilitated by the use of a cardboard prop to stabilize the cap during needle recapping. The card is slid over the cap, aligning with the ridges on the side of the cap. Once properly placed, the card also props up the syringe. This position can be useful when working alone. Locate the large window in the syringe barrel, and then set the syringe so this large window is facing downward and the piston rests on the edge of the tray. From this position, it is easy to pick up the syringe, remove the cap, and be prepared for the injection with a palm-up grasp and good visibility of the cartridge. Once the injection is complete, the needle can be safely recapped with one hand. It is important to note that the card should only be used as a prop for one-handed recapping. The card is not to be considered a protective device for two-handed recapping. The following demonstrates the use of a rubber device to hold the cap during needle recapping. The needle cap is inserted into the wide-rimmed end of the device. This device also acts as a grip for removing the cap. It is then placed on the tray to prop the cap up for recapping. Use of this device also minimizes the risk of needle contamination from contact with the tray during recapping.